Clearly, our society is in crisis. Hello, I am Jannine, and I am a certified registered nurse anesthetist. The legislation of House Bill 178 is an intended bill to cut down on the problems of illegal pill mills. While their intentions are well-founded, Congress is addressing these issues of narcotic abuse by implementing tougher regulations via the House Bill 178. Unfortunately, the House Bill 178 contains language that would end up severely limiting patients with chronic pain access to care. Advanced practice nurses would be prevented from providing therapeutic relief and solutions for the patients as it stands today. I am but one voice of the many advanced practice nurses who care for the nation's people. Nurse anesthetists have been providing anesthesia care in the United States for nearly 150 years. According to the American Association of Nurse anesthetists are the oldest nurse specialty group in the United States. We have played a vital role in the well-being of millions of Americans dating all the way back to the Civil War. Currently, we play a critical role in providing access to care for the 100 million Americans suffering with chronic pain. Advanced practice nurses have always been patient-centered and health-focused. Advanced practice nurses lead the way in providing integrative health care with collaboration of technique, including massage therapy, acupuncture, meditation, and physical therapy. However, our healing hands and minds must not be rendered useless by taking away our rights and privileges to independently practice pain management. For too long, many practitioners have provided medications to mask the pain rather than treat the underlying condition of the individual. As a result, pill mills have become to be a major problem that must be addressed as soon as possible. However, House Bill 178 addresses only one portion of this crisis while creating another crisis in the meantime. Our practice is unique in the sense that nurse anesthetists render care to patients in a collaborative, holistic approach that integrates all the tools necessary to ensure that each individual receives the highest therapeutic care possible. It is imperative that we must retain our current practice rights, or we are rendered inadequate to fully care for the broad spectrum of people who suffer. Our profession of advanced practice nursing is advocacy of the sick. The voice of leadership must stand tall in truth that protects and cares for patients, instead of protecting pockets of those who may inadvertently limit patients' access to care. After all, 100 million Americans are hurting. House Bill 178 would have harmful effects because it would restrict advanced practice nurse anesthetists from practicing pain management in clinics, and healthcare support and treatment would be jeopardized. Furthermore, the monopoly type of language associated with House Bill 178 would not only limit the number of pain management clinics, it would also reduce the availability of care for those individuals suffering daily with chronic pain. Limiting ownership, as well as providing rights that are exclusive to physicians only, the entire community will suffer. What does this mean to the health of a nation? If House Bill 178 passes, pain management clinics may be owned and operated by physicians only. Monopolies have long been seen as a way of cornering the market for personal gain. Such policy would restrict fair trade and thus decrease the number of pain clinics, ultimately limiting those who can get treatment for their pain. This shouldn't be about physicians or advanced nurse practitioners. It should be about those individuals who need access to care. House Bill 178 will no doubt complicate and delay the availability of care for those who are suffering. Pain represents a major clinical, social, and economic problem. The burden that pain imposes on individuals and the enormous cost to society has to bear as a result clearly demonstrate the need for patient-based and health-focused care that is unique to advanced practice nurses. We can't ignore the sick. We can't fix every problem with a simple pill. Rather, we need leadership and a holistic, collective, strategic, and evidence-based care that advanced practice nurses render. Limiting choice and access to care for the 100 million people should not be an option. We will unite, and we will advocate for the millions of Americans who are suffering from chronic pain, as well as defend our rights to render such care. We must stand united as one in order to continue to serve the people of this great nation. I hope you choose to join us in the fight to modify the language of House Bill 178. House Bill 178 should not be about protecting the pockets of those practitioners who seek to benefit from those individuals who are suffering unimaginable pain. Leadership should reflect the integrity of the intelligent decisions that protect and serve the people. For more information and how you can help, please visit us at crna.com. Thank you for your time.